Hello, welcome to the Smoking Education and the Campus Non-Smoking Policy presentation. I am Myra Holyfield Naylor, Master Prepared Certified Registered Nurse Practitioner. The objective goal of this project is to provide the nursing students in the health profession with the knowledge and skills to provide comprehensive tobacco, cessation, and education. The overall project objectives are listed as acknowledge the specifics of the college campus non-smoking policy, acknowledge the epidemiology and identify associated health risk factors of tobacco use, identify health-related consequences of tobacco use, acknowledgement of the CDC fast facts of smoking, awareness of the assessment tool for nicotine dependence in adults, awareness of the 5 A's: ask, advise, assess, assist, and arrange. And last but not least, tobacco use law. Cigarette smoking is the chief single avoidable cause of death in our society and the most important public health issue of our time. All forms of tobacco are harmful. Smoke-free campus. Each of the college campuses and instructional sites are smoke-free. Smoking is prohibited inside all campus buildings and in the areas immediately surrounding them. Smoking is permitted exclusively in the parking lots inside private automobiles. Appropriate containers for disposing of smoking materials are provided, and students and visitors are expected to use them. The use of e-cigarettes and smokeless tobacco is prohibited inside all campus buildings. Health consequences of smoking can contribute to cancers, pulmonary disease, cardiovascular disease, reproductive effects, and other medical diagnoses such as cataracts, diabetes, erectile dysfunction, osteoporosis, rheumatoid arthritis, and many more. But health consequences of smokeless tobacco use can be contributed to periodontal effects, oral leukoplakia, and oral cancers and pharyngeal cancer. Smokers are at greater risk for disease that affect the heart and blood vessels. This would be cardiovascular disease. Smoking causes stroke and coronary heart disease, which are among the leading cause of death in the United States. Even people who smoke fewer than 5 cigarettes a day can have early signs of cardiovascular disease. Smoking damages blood vessels and can make them thick and grow smaller, narrow. This makes your heart beat faster and your blood pressure can go up, and clots can also form. A stroke occurs when a clot blocks the blood flow to part of your brain. A blood vessel in or around your brain bursts. Blockage caused by smoking can also reduce blood flow to your legs and skin. Trends in adult smoking and prevalence of adult smoking. Statistics of smoking from 1955 through 2018 indicate that men and American Indian, Alaska Native have the highest prevalence of smoking. Fast facts. This advertisement shows the powerful sales tactics used to create the illusion of no health risk through the utilization of healthcare workers. Unfortunately, today, smoking is still viewed as cool regarding social interaction. The marketing advertisement has been very misleading until the Surgeon General forced the tobacco company to package their product with warning signs of the possible detrimental causes. The ad is supported for sales with the consideration of health risk factors. Currently, more doctors and nurses are encouraging and educating patients to avoid smoking. The U.S. Preventive Service Task Force screening guidelines advise routine screenings for tobacco and smoking among adolescents and adult smokers. The purpose is to educate them about tobacco use, inform them to stop smoking, and provide behavioral interventions for smoking cessation. Smoking and respiratory disease. Smoking can cause lung disease by damaging your airways and the small air sacs, the alveoli, found in your lungs. Lung disease caused by smoking includes COPD, which includes emphysema and chronic bronchitis. Cigarette smoking causes most cases of lung cancer. If you have asthma, tobacco smoke can trigger an attack or make an attack worse. Smokers are 12 to 13 times more likely to die from COPD than non-smokers. The next slide covers the health benefits of quitting. Beneficial effects of quitting regarding pulmonary effects. Lung function can increase. And then other healthy benefits will be circulation improvement. Walking becomes easier. At any age, there are benefits of quitting. Smokers should always aim to quit completely. This slide is a supportive tool for smoking cessation. This covers the 5 A's intervention. The first step is ask. You're going to ask the patient about their tobacco use. Step 2 would be advise to quit. Step 3, assess the readiness of the patient to quit. And step 4 would be assist with quitting. And step 5, you would arrange for follow-up counseling. Here we have more supportive tools. The Fagerstrom test for nicotine dependence in adults. This is a questionnaire approach that is utilized during a smoking assessment. Here we have a continuation of the questionnaire. And in the next slide, we talk about compounds in tobacco smoke. It is the combination of the other gases and particles that cause the carcinogens and other health issues. Therefore, it is important to educate the community regarding gases and particles such as carbon monoxide, nicotine, ammonia, lead, just to name a few. It is very important to educate the public. Nicotine is the additive component of tobacco products, but it does not cause the ill health effects of tobacco use. Now we talk about the tobacco use law. This law can help patients to identify activities or situations that trigger the desire to smoke or use other forms of tobacco. It's important for patients to understand these environmental cues so that they can develop coping strategies to overcome the temptation to use tobacco. Final thoughts. Epidemiology of tobacco use. Fewer than 1 in 5 adults are current smokers. Smoking prevalence varies by socio-demographic characteristics. Nearly 500,000 of U.S. deaths are attributable to smoking annually. Smoking costs the U.S. billions of dollars annually. And for the individual, a smoking pack a day can cost up to $2,300 annually, plus associated healthcare costs. At any age, as we stated before, there are benefits to quitting smoking. The biggest opponent to tobacco control effort is the tobacco industry. Always be aware of the importance of smoking education and the purpose of the non-smoking campus policy. Thank you for participating and listening to my PowerPoint presentations. For questions or concerns, feel free to contact me at my email address or my telephone number, which is 205-602-9229, and my email is mholyfield@stu.jsu.edu. That's mholyfield@stu.jsu.edu. And thank you again.